Doing our mission to stick to the science when it comes to the COVID-19 pandemic. There are many doctors trying to prove skeptics of the coronavirus wrong. We told you about Jessica Archdale yesterday, who works in the healthcare industry herself. That person to her left, though, is Dr. Mark Meeker. He's been studying COVID since it began. I found out what he's experienced firsthand over the last nearly 2 years now.
And that's where best
OSF HealthCare's Dr. Mark Meeker has had many people ask him whether the COVID-19 virus is real.
My response to them is I've been seeing patients for over 33 years, and I've never seen anything like this.
Mark says they've had bad flu seasons where there have been patients overflowing into their hallways.
But I've never seen the rapid severity, the climbing numbers, and the ICU stays and the deaths that we've seen from COVID. I've just not experienced that in my career.
Earlier this month, OSF had 81 patients in the hospital with COVID. 61, or 75% of them, were unvaccinated. Mark says people need to be humble and understand that doctors don't have all the answers yet because this is a new virus.
And see, people are going to hear that and say, well, you guys don't have all the answers. Why should I listen to the CDC? Why should I listen to health experts like you? But those numbers speak for themselves, do they not?
The numbers are pretty clear-cut in my mind, and that's why I cited our personal experience. And Jared knows this. I mean, he's an ICU doctor at St. Francis. He knows this better than I do.
Jared, Mark's son, has been dealing with COVID patients since the pandemic began.
Although it's not a perfect vaccine, it doesn't need to be. It needs to be effective and help, and it certainly does that.
Mark says there's no one solution to the virus, but vaccines are probably our most effective defense against COVID, more so than wearing a mask.
There have been millions of doses given. There were tens of thousands of patients studied in the original clinical trials to get the emergency use authorization. So these vaccines weren't rushed through and not studied and not scrutinized. They were highly studied, first in animal studies and then in human studies. And now we have a ton of experience. So I think that the vaccine data is very solid.
Now, the number of hospitalized patients is down at OSF from the summer months, but their medical center in Peoria did see a mini spike in COVID-19 cases last month.
Now to the push to get children vaccinated against COVID-19. News 8's Nina Burns is here to tell us about a special clinic taking place at the Rock Island County Health Department. Nina?